All right, good morning, everyone, and welcome. We are going to get started. Uh, Thanks for joining us today for our Outreach Connection webinar for certified childcare centers. We will, on behalf of the licensing unit, we are going to be presenting some great information for you as program operators and center operators and program owners and directors for certified centers. So my name is Rena Henjum, and I am a child care center training specialist and today's host for the Child Care Center Licensing Unit within the Licensing Division of the Minnesota Department of Human Services. I'd like to thank you for being here with us today and wish to thank you for all of the hard work that you do throughout the state to support children and families. Outreach Connection webinars are one way that we as a licensing and certification team have worked to bring relevant information together from us and some of our state partners to make certain you are hearing you're hearing information and updates directly from us, in addition to the other ways we communicate information, such as via email and on our website. We work hard to connect, to hear from you, and to partner for ways to support the work that you do for the children and families of Minnesota. Today's presentation is just that, a way to connect and provide what we think is valuable and useful information for you. There is an accessible handout. I've put a link to that in the chat, but the handout also exists on our certified web page. So before we get started, we have a couple of housekeeping items to just go over. First, like I just mentioned, the accessible handout with links to more information from today's Outreach Connection webinar is posted on the certification webpage under the News and Updates section, inside the toggle that is titled Upcoming Outreach Connection Webinar for Certified Childcare Centers, which is how you were able to access this webinar today. So yesterday the handout was not there. Today the handout is there. Second, today's presentation is being recorded, and the recording will be posted on our webpage as soon as we can get it through the transcription process and have it all ready to go for you. Now for our agenda for the morning. So we've heard from certification holders that there are certain topics they want to hear more about, and so there's much going on in our industry today. We take that feedback seriously. Therefore, as shown on this slide, we have invited content experts from several of our partners to share information. You will hear first from Karen Kunze, from our policy analyst with the Policy, Legislation, and Stakeholder Engagement. You are going, and then she's going to be providing the legislation update. You're going to hear about the transition to the Department of Children, Youth, and Families from Christina Krull, the Project Management Coordinator. You are going to hear about some Provider Hub general updates for certification from John Sill, our Provider Hub product manager in our digital services team. You will also going to hear about the Great Start Compensation Program from Dana Ellingson. She is a support specialist over at DCYF. And then Carrie Leith and Michelle Hatlily. Carrie is a supervisor for certification, and Michelle Hatlily is one of our certified licensors, and they're going to give you some certification reminders. So I'm going to hand it off to Karen Kunze to take you through the next couple of slides on legislative updates. So
great. Thanks, Rena. Good morning, everyone. Like Rena said, my name is Karen Kunze, and I'm going to give a brief legislative update. Go to the next slide.
Yep. So sorry. I wandered my mouse off there.
So my colleague Christina will be sharing more details about the transition to the Department of Children, Youth, and Families, but I just wanted to touch base quick about some statutory changes. So effective June 18th, of next month, when we transition to the new department, the existing certification standards that we currently know and are found in Chapter 245H will move to a new chapter of statute called 142C. So the requirements aren't changing, they're the same, only where to find them is changing. So we sent out, and this was what the legislature passed last session, last year, with an effective date of this year. So we sent out some information last year to give a heads up about this change, but we just wanted to remind folks that now this is happening on June 18th. we have created a crosswalk document to help keep track of where things are in 245H and where you can find them in the new chapter of statute. So I'll put that again in. That's been sent out previously, but I'll put it in the chat and encourage you to bookmark that page and just use it as a helpful reference as we all adjust to these new locations. It's important to keep in mind that the background study requirements that you have to follow will continue to be in 245C, so they will not move. And similarly, the Maltreatment of Minors Act requirements in Chapter 260E will stay there and will not move. So it's only the requirements in 245H that will be moving into 142C. Next, I want to give an update on the 2025 legislative session. As you may have been following in the news or heard, the regular 2025 legislative session ended yesterday. Unfortunately, the legislature ran out of time and was not able to complete all of the budget bills. So some budget bills passed, but the Health and Human Services bill is among those that is left unfinished, and that's where any provisions that impact certified centers are. So a special session will be called by the governor. The timing of that is still to be determined. So after the legislature does complete its work, and if once a Health and Human Services bill passes, we'll be sure to prepare a certified center legislative implementation plan as we do every year, and we'll email that out to those who are on the listserv and to the center operators and authorized agents, and that'll be posted on the website as well. So I apologize that we can't give more concrete details at today's presentation, but we'll be continuing to follow the legislative session and the special session, and we'll share more information once it's solidified. So with that, I'll pass it back to Rena.
All right, thanks so much, Karen. Next, I'd like to introduce Christina Krull, our project management coordinator with the Department of Children, Youth, and Families, and she's going to talk about the transition to the Department of Children, Youth, and Families.
Hi, my name is Christina Krull. My pronouns are she, her. Got a bunch of information to go through today, and the good news is we will have some of this in the handout, and we have a website that has all this as well. So just going to cover a little bit about a reminder what's going, what's not, and what's changing and what's not in terms of how you work with our programs. So first of all, what's staying here? Hopefully this is not news. We are keeping here at DHS the Child Foster Residence Settings Program, Home and Community-Based Services, Mental Health, Substance Use Disorder, and Children's Residential Facilities, as well as our Adult Foster Care and related programs. Our Background Studies Division is staying here entirely. We're not sending any staff over to DCYF, but we will continue to serve DCYF through an interagency agreement. This is a setup we already have with other agencies, so just following that same path. You'll keep working with background studies for your studies. Nothing is going to change there. But the only little thing that is changing is that disqualification reconsiderations for transferring programs will be done by staff at DCYF. But otherwise, just keep doing things the way you're doing. Likewise, our provider hub team is all going to stay here at DHS. It's hard to split up product teams. So that team will stay here and again serve DCYF through an interagency agreement. So you'll keep contacting them the same way you do now. They'll all be here at DHS. You'll keep using the hub though. If you're using it now, you'll keep using it. Nothing is changing in terms of usage just because of the transition. What is moving over to the new agency includes licensed and certified childcare centers, our family child care team, family child foster care team, and child caring placing agencies. Those are all going to be served by DCYF licensing. Importantly, we will be splitting up our maltreatment investigations team. We'll be sending some staff to the new agency to take care of work for licensed and certified childcare centers. So you all will be working with them for your programs moving forward. Our child care regulation modernization project is also moving over. So both the work and the staff you've been working with over the last couple of years, they'll be over at DCYF. And our program integrity oversight team that does childcare audits and investigations, they're all moving in full as well. So we'll have 130 some positions at DCYF OIG starting June 18th, and the remainder will all stay here at DHS. For you all, I want to flag a few things that are staying the same and one little thing that will change. Because of the transition, we're not changing who's doing what. So you will continue to be certified by the state of Minnesota with your current licensor. That's all staying the same. Nothing's different for you on that front. It'll just be a different agency. Your certificate that you have right now that says you're official, you don't need to get a new one for June 18th. It's fine that yours will continue to say DHS on it until it's time for your regular renewal. When it's time for that, we'll just make new versions that have the DCYF logo and the new signatures and leaders, but otherwise, don't worry about it for right now. We're good with what we have. And also your number won't even change. So nothing we need to do about this in the short term. You'll just keep interacting with your same people you do now, just they'll be at a different agency. One thing that will change, you might see, oh, sorry, go back. That will change is the licensing action templates. If you get one of those, it'll just be a little different in terms of the branding, the commissioner name, and statutory references. But wherever we're making changes like that, the content is not changing substantially. It's just those small tweaks. What is going to stay the same is some programs will continue to report child maltreatment things to DHS intake. So that is the 6600 number. You continue to make reports there for home and community-based services, children's residential facilities, and substance use disorder treatment facilities, as well as our extended foster care and a child foster care setting. Those should all continue to call the existing investigations number, and we will handle those at DHS. However, we will also have a new phone number. Like I said, we're splitting that team, which means we need to make new forms of contacting them. So starting on June 18th, you can report maltreatment at licensed and certified childcare centers at our new number, which is 651-539-8222. Again, this is in the handout and on our public website we'll share at the end. So this is very important information, I know. So I just want to let you know you will need to report there starting June 18th. Now, if you call the wrong number by mistake, out of habit, it's fine. The teams are ready to send things back and forth, especially at the beginning as we all get used to this. I do want to flag that you'll need to update your maltreatment reporting policies to reflect that new number. Now, what I've heard from Peggy and the team is that they're not going to, ding you immediately on June 18th if it's not updated. There will certainly be an education campaign at the beginning, but please do put this on your to-do list in the short term to update your policies to reflect that new phone number. If there's an investigation underway at a future DCYF program before we transfer, that whole investigation will move with the team over to the new agency. So even if it's not wrapped up, it's fine. We'll just move it with the team and it'll continue there. We won't leave it here at DHS. A lot of the contact information you'll use now will stay the same. So if you have someone's employee's email address, their individual one, those are not changing. Those are the same. A lot of our phone numbers that we have now, these main phone numbers, are staying the same. Like I mentioned, our intake number here, 6600, we're keeping it staying the same. It's just changing which programs it should be reported to it. We have our main DHS licensing number, the 6500 number. We're keeping that number, but we are changing the call tree so it won't have those DCYF options. We'll talk about in the next slide. There's a new equivalent for the transferring programs. Your childcare center line, the main line 6015, is staying the same. Nothing is changing with that one. The employee phone numbers for our childcare center staff, those individual numbers, if you have them, keep using them. They're not changing. Not true for everyone, but for your staff contacts, it is. The mailing addresses and the PO boxes we are going to keep for now. We had planned to leave the building we're in next year, but obviously with our return to office situation, it's a little more up in the air. If one or both of us leave the building, whenever we split, we will have to update those PO boxes, but for now, it's easiest for us to just keep sharing them for both agencies. So in general, sorry, one quick last point there, that continue to contact your licensor or the one on call. For you all, very little is changing. Your teams are moving in full. It's all good. All right, now I'm good. What is changing is, as I mentioned, there will be a new licensing mainline for DCYF, which is 651-539-8300. So that will have those call options for the transferring programs. As I mentioned, we have that new intake investigations number. And if you ever do need to fax us something, we got one. It's hard to get that because it's not a thing people request a lot anymore. But if you ever need to fax us, we will have one for the new agency. We have some new email addresses available that will go into effect in June 18th. The one I've got here that's most relevant is probably the intake stuff. But by and large, especially for these programs, we'll be transferring existing email addresses over to the new agencies. We'll just update them because almost all, I think they all have a little DHS in them. We'll just change that to DCYF. The good news is the old ones keep working, so you can still email the old ones. We're just asking you to please start updating your contacts for the new ones. At some point, I think they'll cut us off on the old ones, so please start changing over, but at least it's not a hard shutdown on the old ones in the short term. I have some examples here on the next slide. So we have like dhs.ccc.licensing will be DCYF. So pretty straightforward. Whatever it was before, you just almost by and large for all these ones that you're going to use, you just change out the agency name. That's all there is to it. Our web pages will mostly still be on DHS's site as of June 18th. We'll have, I think, a few pages over on the new site, but we're not nearly done with our migration work. So just know that you'll probably keep going to most of the same sites you do now. Over time, we'll move that content to the new pages and set up redirects from the old pages to the new ones. Nothing's going away until we've got a new home for it, don't worry. I do want to let you know that the pages are not going to look identical at the new site as they did before. And that's for a couple of reasons. One is that DCYF's web page is on a different platform. We're on Tridion, they are on Drupal. They do not produce identical pages because they are different platforms. The other is that DCYF has a different approach to how they do their web pages. So they have like more pictures, for example. So just wanting to let you know, when the pages are there, they're not going to be exact copy paste. It'll be a little different, but the content will all still be there. Likewise, our form updates will not all be done on June 18th. We're working through that. We're prioritizing the most important ones to get done for June 18th, and the rest will be done over time. You'll look for things in the forms like new branding, statutory numbers, and contact information. Again, these are more minor changes. We're not wholesale revamping things. For other programs, there'll be things where we split up forms, for example, in foster care, but for you all, your whole program's moving, so there shouldn't be too much change. We'll keep emailing you from GovDelivery, but for your programs, that will start coming from DCYF's GovDelivery account. So you'll just notice a small change in the from email address. It's not a big deal. Just wanted to let you know that will happen. We will migrate all of our existing topics and subscribers to the new account. So we'll keep doing the frequencies and lists that we have now. It'll just be from a little bit of a different location. In terms of IT applications, you'll keep using what you're using now almost entirely the way you are now. So like the hub, as I mentioned, keep using it the way you do now. Your existing login's the same, your permissions are the same. We'll keep using NetStudy 2.0 for background studies. Any other applications of ours that you're using, nothing should really change for you. It'll just be on our end, we'll make some changes. But other than that, should be pretty straightforward. We sent out an email about this with some preliminary information back in March. I'll put a link to the chat in a sec with a link to that one. We're going to send out more information by email before June 18th. And we do have as I mentioned, a new website online that has all of this information and more about what's moving, what's not, what's changing, what's not. So you can check that out. I'll put the link in the chat as well. And we'll update that as we get more information as we get closer. So that's more to come. We're pretty close. I'm feeling pretty good about where we are for a month out, honestly. We're in a good position, and I have confidence that things will go very smoothly.
Thanks so much, Christina. All right, next up, we have John Sill, who is our Provider Hub product manager in the digital services area of DHS. So John is going to take you through some information about the Provider Hub. Take it away, John.
Perfect. Hey, Rana, just a quick heads up. Can you hear me okay?
Can hear you totally fine, and we can see you.
Oh, perfect. All right. All right, so yeah, like Rena said, I'm John, still the Provider Hub product manager from Digital Services. So just here to give you a few updates on the Provider Hub. So if we can move to the next slide here. So this is just a quick broad overview to remind folks what it actually is. The Provider Hub is a place where you apply for certification funding and programs, where you can manage your certification and program requirements. Of course, log in anytime from any device, as long as you have internet access, and it's accessible in 4 different languages: English, Hmong, Somali, or Spanish. Some current features of the Provider Hub. Obviously, licensing and certification is in there right now. And we've had some new features that have launched recently, including Child Care Assistance Program, or CCAP, the Great Start Compensation and Support Payment Program participation, and enrollment and attendance. All those different features are now live in the Provider Hub. If you are wondering about any new developments or any news for the Provider Hub, please sign up for any the Gov delivery list. That's where we will send any sort of like release notes of what's new, and of course those ever valuable system down maintenance emails, just to give folks a heads up that every once in a while we have to take the system down for those enhancements or any sort of fixes. And there is a Provider Hub webpage, but that is currently being updated, and we've got some top-notch designers, UI folks that are helping redesign that experience in that website. So we're excited for what they come up with. So updates to share today, essentially just 3 of them. We are continuing work on improving the process to submit staff training and qualifications, or otherwise known as the personnel redesign. Please know that we will keep providers updated on when that will be launched and whatnot. We'll be providing that information. So you haven't heard any updates recently because we don't have anything new to share currently, but just know that work is still being done. A few of the other updates that I'm going to share today is just the preparations of that DCYF transition and how it impacts the Provider Hub, and then new resources available for certified child care centers. DCYF transitions. Essentially, the main parts of the transition for us is that the certificates will be updated to reflect those changes. You know, it's gonna update those statute references, signatures, all that good stuff. And then we're going to be transitioning from the Department of Human Services logo to the State of Minnesota logo. Currently in the Provider Hub, you've got DHS in the top left corner. We're going to get rid of that since the Provider Hub will be used by multiple agencies. And as Christina and others have mentioned, we are targeting June 18th for those key revisions, with others to follow afterwards to help support that DCYF transition in the Provider Hub. Another new update are new resources. So on your screen on the left is our knowledge articles in the Provider Hub. That's where you can get kind of a short overview of certain processes or ways to use the Provider Hub to do certain things. So for example, making change requests, you know, where you're making a request to update the location, your program name, age category served, all that good stuff. There are knowledge articles that you can look up under the Help and Resources tab in the Provider Hub. But then on the other part, on the right-hand side of your the slide, there is a full process or an entire guide that is linked from those knowledge articles, and that will it's just more robust kind of training materials that our instruction designers have created for you all to utilize. And then another big piece is the introduction to the Provider Hub, almost like a Provider Hub 101 course. Oh, almost like a Provider Hub 101 course. It's great for new users of the Provider Hub. So if you have some folks who are curious and want to learn more on some of the basics and fundamentals on how to use the Provider Hub, like create an account, log in, change password, select your language, change user permissions, this interactive course will help guide folks into figuring out answers for those questions. Again, as with some of our other materials, we are trying to ensure that we are being equitable in all of our work. So we are building all these instruction materials, and translations are underway to help support Somali, Mon, and Spanish for these resources. And then this slide is just essentially kind of an overview of what we just chatted about. So please refer to those support articles or knowledge articles in the tool itself. You can find additional resources at that website. And then based on, honestly, based on questions that are sent to our product support team, new resources are being created on a regular basis by our instructional designers to make sure that folks have answers to questions they have while using the Provider Hub. And as always, there is live support too. You can submit a support case within the Provider Hub tool itself. There is a lovely and dedicated local team that responds to those cases Monday through Fridays, 8 a.m. to 4:30. And the team will connect you to the applicable licensing or program team as needed. And then one other sneak peek, I know that team is also trying to build out a new functionality of where you can schedule phone calls with that team, maybe in off-peak hours for that additional support. And yes, please, any questions, anything, really, feedback, questions, whatever, feel free to email us at that email address, ccproviderhub.dhs@state.mn.us.
Great, thanks so much, John. Next up, we have Dana Ellingson, who is a Great Start Compensation Support Specialist, and she's going to take you through updates about that program. So, Dana, take it away.
So, yeah, just verify you can hear me before I start talking to myself.
Yep, no, I can hear you great. So
Great. Hello, everyone. Thank you so much. Wanted to just provide some updates, but before we begin, sometimes we have individuals who are newer to the information. So a grounding information slide here for you, that the Great Start Compensation Support Payment Program is a program designed to increase your compensation as childcare providers in the field, benefiting workers and to support the childcare industry. And eligible providers currently apply each month in the Great Start compensation payments, either in the hub if they are certified programs such as those attending today, or on the right-hand side at the very bottom, it mentions that there are maybe some providers who are not yet there as we're continuing to build, and you heard from John. And again, providers accepting these payments also agree that they'll let us know how they're using the information or using the funds and give that information to the state. So we're working on some reports that have gone live into the Provider Hub as well. So you can find your Great Start applications in the Provider Hub, and you can also find Use of Funds report, which would be a way to report how you use the funds. That's available to those depending on when you started receiving the funds. So if you began receiving the funds when the Great Start Compensation Program began in October of 2023, you may already have that and have filled it out or have it available to you. And that will be on a yearly basis for providers. The next slide, again, just reminds us of a continuum or a visual here of what's been happening for the Great Start compensation. I was talking about the use of funds of where we're here right now in the middle of the screen, that we've made some small updates to that use of funds report recently based on feedback and making sure we use your information back or providers' information to let you know or make changes so it's easier. So that's been happening. Also coming out at the very far left that we have a new support phone line that's connected within the Provider Hub so that we can get you to the right people in a quick, fast way. And that new line came out at the end of March. So if you've called into the phone line, it's the same people answering the call, just a different number. On the far right of this slide, you'll see there's a functionality for supplier ID, which is a way for providers to be registered with the state to receive funds in a more secure way. And so that functionality will be going live, and you'll be receiving an email late May about that to give you more details about that functionality that you'll see in the Provider Hub. And another way to see your PDFs just looks a little bit different. But again, basically, we're making changes to make things better for you based on feedback we hear from those calling in to phone lines and providers themselves. So thank you for those that have contributed to that feedback. Next slide that you'll see is, again, some of the why behind that use of funds report. We've heard people like to hear this, that reporting that impact of the Great Start compensation payments helps us to understand better how it's impacting you, but also improving support for early child educators in the field as intended, and also that we're ensuring that responsible use of funds is being made in the use of in Minnesota for the way that those dollars are being spent. Are they being spent the way we want them to be spent, or they were intended to be spent, I should say. New functionality on the right, I just mentioned the report is available for some, for those that it's due, and then also updates or getting ready to show you a supplier ID functionality in the hub is coming. And then also a different way to download, or a different view for you for downloading information about what you've submitted. All right, next slide. That you'll see an update. That's good to hear, that the full-time equivalent amount, the FTE amount, will remain at $375 for the July 2025 through June 2026 Great Start Compensation Fund, those application rounds. So currently, one FTE is a staff member who works 32 hours per week, and it is at $375 per FTE right now, and will continue through June of 2026 at this time. That's what we know now, and wanted to give you that update. It's on our web pages, but wanted to make sure you heard that today. Next slide. We'll also share another update that we will be sending out here again at the end of May, an update email to you, but wanted you to hear it. This slide basically tells you that starting in June of 2025, you can bring your eyes just to the box basically that says there's a change. So for those that are applying for the Great Start compensation payments, you must be licensed and certified by the state or by a license by a tribal nation, but you also need to be in good standing with the state or that tribal nation for at least 1 day now versus 5. So you see a strikeout of 5 calendar days, and it's now just 1. Also be open and operating, serving children for at least 1 calendar day during that funding period, and serving a minimum number of children for at least 1 of those calendar days during that funding period. So for an example, this goes into effect in June. So the June application, or the times and the dates for June actually get put on the July application, but you'll make sure to note that in July you may now be eligible where maybe you weren't going to be. For an example, if your program closes in June, the very first days of June, it once was that you would need to be open for 5 days. Now you only need to be open for 1. So make sure to apply in July if that is you. Wanted you to hear that message. Next slide, please.
That's it for you.
Thank you.
All right.
Thanks everyone for the opportunity.
Thanks, Dana. Thank you very, very much. Now we have Michelle Hatley and Carrie Leith here to talk to you all about some reminders for certified programs. So take it away.
Hello, this is Carrie Leith. I am so sorry I cannot change my settings here, so I don't know why. You're not seeing me, so I apologize for that. Can you hear me okay?
We can hear you good, and yeah, you can go ahead and turn off your camera. It's kind of a weird thing that's going on with your
Okay.
You sound great.
Yeah. Okay, perfect. Well, first of all, yes, I'm Carrie Leith. I'm the supervisor here for certified licensors. I want to thank all of you for taking the time today to be a part of this webinar. I know as the school year is winding down and we're starting to get amped up for our summer programming and that it's a very crazy time for all of you. So I appreciate that you have taken the time to be a part of this today. I am going to just give you a quick update on a few things that we see trending in licensing right now with our investigations and what we see when we're out on site doing your annual reviews. So the first thing I want to talk about is allergy information. So when you enroll a child and they have a known allergy, we need you to make sure that your allergy information includes all of the required information. That would be the description of the allergy, specific triggers, avoidance techniques, symptoms of the allergic reaction, procedures for responding to allergic reaction, including medication, dosage, and doctor's contact information. We do at DHS, and it will carry over to DCYF, have a form that includes all of these requirements that you can use that would ensure that you meet our requirements. However, the form is not required. And as long as you create something on your own that includes all of that information, you would be in compliance. Once you have all of that information, you need to make sure that all of your staff that work with that child are trained on that. So once you train them, you must have the staff person sign off on that allergy information at the time of the initial training. And then moving forward, it has to be at least annually and when there's any changes made to the allergy information for that child. So let's say you have one starting here in June and you do all of that training, and 2 months into the summer, parent comes back to you and says, oh, we have to change the medication, or we found out that this is no longer a trigger, or we have additional symptoms, and you update that. You need to make sure that all of your staff are trained at that time. Please make sure that if your staff signature is not legible, that you have your staff person print their name next to that so that we can tell what staff that is that was trained on it, and make sure they put the date that they received that training. And licensors will be reviewing that when they're out on site. The other thing that we want to talk about is in the hub. As all of you are entering that training information into the hub, we want to make sure that you're keeping all past training dates as well, and so that we're not getting rid of any of that information. So I know there's times licensors come out and look at things in the hub. They might have some questions, or might be a date wrong. At this time, we are asking if you have additional documentation on site, and the licensor can then look at that as well. And if by chance there was an accident on what was entered into the hub, we would just give you a little PA to go in and change that date if we see it on a written documentation that you keep at the center. The other thing about allergy information, please make sure that that is available where all food is prepared and served. So wherever that is prepared, if it's in your kitchen, you should have a copy of that in the kitchen. If it is in the school cafeteria where you're serving it, you would have that information then in the area that the children are eating. Or if you are having children eat in classrooms, you would need that information in there. The other thing is summers come up a lot of times. Children are eating off-site, maybe out on the playground. You just want to make sure that information is available for staff. The other thing that we have seen as a trend, this is kind of a reoccurring theme year after year, is supervision of children. So we have seen an increase in child-on-child inappropriate touch. When we get those reports coming in, we do investigate those as supervision. So a licensor would come out to do that investigation, and we're looking at supervision. So some things for you to think about when you're looking at children, the supervision for children, and things to talk to staff about, is you need to know what the history of the children is. So both individually and between each children with each other. So if you have children you know that have exhibited things in the past, your staff should all be aware of that and have an extra eye on them out on the playground, going into the bathroom, in spots in the indoor areas that you are using that they might be able to kind of go off radar a little bit. You need to make sure that staff are aware of that and watching children. Some other things to think about is the age difference between children. A lot of our school agers, we have young children, sometimes just not even starting kindergarten, but they'll be starting kindergarten in the fall, and then we have the older children mixed with them. So we want to make sure that we're keeping the age of the child in our minds to make sure we have that adequate supervision. You'll also want to look at your risk reduction plan to see what that entails and decide if you need to update that for any reason. And you can feel free to update that. If you update any of it, make sure you retrain your staff on that. And then you want to make sure you have a plan to mitigate risk in the future if you have this incident happen at your center. So again, documentation that all staff have reviewed all trainings when it's made, and make sure that's on site, and licensors would be looking at that when they come out. Another situation we run into with supervision is children being left unattended. So this time of year, a lot of times it's out on the playground. Child gets left out on the playground and the group goes inside. The child could be found by a community member or just randomly walks in on their own at another time, or staff might realize it and go out after a period of time to gather that child. But it's always worth talking to staff about that before your summer schedules change, so that they're aware that that is something that happens out on the playground. We also have had some situations where if your policy is to let a school ager walk down to go to the bathroom by their own, we've had some situations where the child then just walks out the door and then goes home or goes to a friend or a relative's house. So just make sure that if you have children that you know kind of exhibit that pattern, you have that supervision piece in place that all staff know to have that extra eye on that child. And it would not, I would advise, especially the beginning of the summer, as you're getting to know, your staff are getting to know the children, that you just have that extra measurement in place to make sure that children are being supervised as they're transitioning to different places. The next thing I want to talk about is hours of operation. So if you are a program that during the school year operates morning and afternoons, and the summer you will be offering a full day program, you need to go into the hub and change your hours of operation. We do have a knowledge article that Alyssa just dropped into the chat that will help explain how you do that change, but please make sure that you have that in place before you start operating for your summer hours. The other thing to keep in mind is at the end of the summer, when you're switching back to your school year hours, you'll need to switch back and change those hours back. So you do at the beginning of the summer and the end of the summer if you see any changes. If you do not have a change in your hours at all over the summer, if it's the same during the school year, if you're a preschool program, then you would not need to go in and change that. And then just as a reminder that when you submit that change in the hub, your licensor will need to approve that before it goes into effect. And with that, I am going to hand it over to Michelle Hatlily, and she is going to talk about some background study things for you.
Yeah, just a quick point out on this slide that is being shown. This is our information on how you can contact the licensor on call, and then the licensor on call email. So yeah, if you want to switch to the next slide. So a few things regarding some background study requirements and reminders. Individuals affiliated with a licensed and or certified child care center must complete background studies every 5 years. So this includes all staff persons, your authorized agents, your center operators, your directors, substitutes, and any unsupervised volunteers that work or volunteer in your program. To comply with this requirement, new studies must be submitted no more than 90 calendar days before the background study is expired. You can check the expiration date by logging into your NetStudy account and looking at your roster. And then just a quick shout out that DHS will continue to cover background studies and fingerprint fees through December 31st of 2025. Next slide. A couple things to point out about your NetStudy roster. Just make sure that you keep your NetStudy rosters up to date, and that you're making sure that the studies are compliant. For staff persons that are changing locations due to summer or back to the school year, just make sure that you affiliate them to the appropriate certified programs roster. So if you have a staff person at school A for the school year, but during the summer they're going to be working at school B, making sure that they're affiliated to the school B NetStudy roster. And then just making sure that you're separating any individuals who no longer are part of your program. And then next slide, and then here's background study information. It talks about the call center. They're open 10 to 3. The email address that you can email to send questions to. And then, yeah, otherwise you can also email your licensors. We can try to help as much as we can, but some things we don't know the answers to regarding NetStudy, so we'll have you reach out to the actual background study unit.
Well, thank you, Michelle and Carrie. That was great information. We've reached the end of our presentation. I know that we provided you with a lot of information. As a reminder, the handout is in the chat as well as posted on the certified webpage, and that has live hyperlinks to many of the items that we spoke about today. And as well, once this recording is all ready to go, we will post that on our certified webpage as well, so you can review it at any time. So thank you all so much for all that you do. And we can give you back a little bit of your time. I hope you all have a good rest of your day, even with all the cold, rainy weather. So thanks so much.